Actually, as a hospital, we have never had the opportunity to work from home. Let's first say this.
Yeah.
So, coming to that, we really had to work on site at all times. So, this question should be, I think, taken more by people who are having that experience of working from home. Having said that, we were always on site always available because the hospitals were never possible to run sitting at home. And patients were always supposed to be looked in person. Even then, we built a lot of innovative ideas in the hospital to address the patient's difficulties, from video consultations to many things. While we were on site, patients were sitting at home. Let's understand that. Why talk about only 5G? I can do that even with 4G technology. So the thing is that, yes, everybody is talking about 5G without, without realizing that even today you can do those things. Where networks are concerned, there are powerful networks. Yes, 5G will improve the speed and the performance. However, today, how much of us are utilizing what we have? That is more important. We have got the best of networks even today. We have got the landscape is open to the rural areas even today for healthcare if we are willing to expand ourselves to that level. So if I talk about healthcare going into rural areas, if the kind of policies are there where the government will allow us to transfer the data or to access the healthcare facilities in the form of telemedicine, in that sense, networks will automatically help. But are we really ready to do that? There are a lot of companies who are actually willing to go into the rural areas and build that kind of infrastructure over there, Reliance also being one of them. But what are the policies governing the data collection? What are the policies governing the connectivity? This has to improve, that has to be defined, and that has to play a major role in the success factor of creating that environment. Yeah, so actually, yes, the cybersecurity or zero trust security is a must in every industry, not only in healthcare or in finance or anything. We need to understand one more point which I would like to highlight. Everybody talks about building the security at the entry level or at the level where you are securing your servers and your high-end data and everything. What about the internal security? How many environments create data breaches within the organization by the people of the organization? And how much do we try to protect that at the level of zero security? So I would like to really see tools being used in such a way that this is covered as much as the higher level of security is looked at. If today I just point out one example, in hospitals, in the last 3-4 hospitals that I've worked in the last 10 years, I've seen majorly for communication, simple tools on the phone. Recently, of course, WhatsApp is like the tool to use for communication internally. And users are sharing data all across in WhatsApp just to communicate fast and quickly to give services. How do you take care of these kind of breaches where data is lost or exposed with, with a zero trust security tool to cover this kind of data breach? So this has to be. As an intelligent CIO, my God. Okay, so yeah, in the space of hospitals and healthcare specifically, I would like to see a lot of insights coming out through predictive analytics, which will really make a lot of difference in the medical field. A lot of companies are already doing it, and that will bring a lot more benefits to the patient. That is most important at this stage, purely from a hospital perspective.